Hi, I'm Madonna. I'm from New Leaf Natural Therapies, and this is David Shield, holistic counsellor.
Hello, everyone.
We thought
yeah, go on.
we thought we would have a really quick chat about drug side effects and what we can do about it.
What sort of drugs are we talking about?
Well, there's been such an influx of new people having antipsychotics, antidepressants, and anti-anxiety drugs in the last 4 years, particularly because of the stress of the pandemic.
Which shows in the studies.
And a lot of people are now trying to get off these medications and are having real issues. So I know from a naturopathic perspective, what I tend to do is really help the body detoxify as quickly as possible, clean up the cell receptors so that the body's real hormones can start being released. Because when we're told that we have a chemical imbalance and we go on a medication, do you know what those chemicals are? They're generally nutrients. So from a naturopathic perspective, we need all sorts of nutrients to create hormones like oxytocin, like dopamine, like serotonin. So without those nutrients, we tend to have more mental health challenges.
Yeah, I've spent a lot of time looking at the side effects of, there's all sorts of ones, the SSRIs and the benzodiazepine. They call them all funny names, so it's hard to work out which one is which. And they call them different names in different countries. So it's very hard to work out what the actual thing is without looking at it. An important thing about this is if you get any of these drugs is to make sure you look at what the label says. Because most of them, a lot of them have the potential to have severe side effects. And maybe that's very rarely, except they're very, very severe. And also when coming off them is very difficult for people, and you need to taper them, or the side effects are dramatic and really painful, and they can last for years if they're not managed properly. And a little thing here, there's a YouTube channel called Dr. Joseph, and Van Goring is his last name. He's got a lot, but he specifically deals with tapering, and there's other websites online to do that. Because I can't give advice on that, I'm not qualified. But for anyone who's wants to withdraw, you want to make sure you work out what the tapering is for that particular drug, because some people you can't just go half and half and half by a week, because some of the side effects you can get there, even though
no, we have joint clients who have been so damaged by going off them too fast.
Yeah, well, that's not. I've watched dozens and dozens and dozens of interviews, and whether they're benzodiazepines, whether they're SSRIs, whether there's other treatments they use like TMS, and they say they're safe, except they are safe for most people. Except the thing is, if you actually read the labels and you see the side effects, cognitive, they can increase depression, they can increase anxiety, they can all of them have cognitive side effects for people. And so it's like it's very good to, like, for example, if most people were told the extreme side effects before they went on them, I don't believe they'd take them as being.
No, people are not given real advice.
Well, to the correct, you just, like anything, if you're told what the real side effects are of something, in the rare cases, that will affect your decision making.
Yeah. I had a lady yesterday who's been on HRT for 9 months, and really interestingly, she had all these massive side effects. But when she spoke to her doctor said, yes, menopause side effects can be this, this, and this. So did not even discuss the HRT that she was on, which has all of those side effects. So doctors often don't know, or they're too time poor to look into it. They're told things are safe and effective. Psychiatrists, I believe, are the same in relation to these drugs. They've been using them for so long and believe that most people are fine. And they believe most people are fine being on them for the rest of their lives.
Well, the thing is that you want to look at the labels, and they do put some of them there, and even the ones that they don't put all the extreme side effects.
So you mean the side effects?
The side effects.
Yeah,
but
right.
So in rare cases, they cause extreme, like the studies coming out on COVID now. I was talking to my supervisor the other day, and their studies are coming out that they have cognitive side effects too.
Yeah, absolutely.
And so all of these things in rare cases have cognitive side effects. And the other problem is that if it really is a chemical brain imbalance, then the uptake during COVID, which was like this, those people were normal before COVID. So do they really have a chemical imbalance?
Yeah.
You have to wonder about the logic of that style. And another thing is a lot of things that are dealt with drugs, you get a prescription, it's ongoing, it costs a lot of money. Counseling will often do the same thing, and it can help more because you get to the underlying thing. Like, what's the underlying thing? And also with a little bit of herbal support, which Madonna does, they have some side effects too, and so does counseling, but they're a lot more small and rare in most cases.
Yeah, that's awesome. Yeah, I love helping people regain happiness, health, and their life back.
It's so nice when you get a hit. And I've seen you get some hits lately with that.
It's pretty nice. It's nice. There's a bell curve, isn't there? There's a bell curve of health. So many people are at the top of the curve and they're just waiting to come back, to get off that.
Recovery is so beautiful.
Oh my gosh, absolutely. Thanks, David.
Thank you.